So the toe's numb. We've scrubbed the foot with an antiseptic. And now we're going to put a little tourniquet. This is called a tourniquet. It's a little ring that will keep the toe from bleeding. You don't lose enough blood to worry about. The problem is when we go to kill the root, if it bleeds, it's going to wash the chemical right back out again. Okay, next we take an elevator. This is to separate the skin from the nail. And he's not only got a lot of infection, but he's got this, which is called proud flesh, or excess granulation. Doing okay? Good. Good. Yeah, you probably don't want to watch it, but you shouldn't feel anything. In fact, the part I just did is what would hurt the most if it wasn't numb. So we're taking out the bad part of the nail right now with a little extra.
Sorry, I was...
And we're going to try to take some of that excess tissue. And some of this will just have to go down with time. And I'm going to be ready in just a second for that culture, if you want to come behind me and get that. Okay. So before we go any further, we're going to take a culture. We don't do this on a lot of them, but because his is so infected, we want to make sure that we get the right antibiotic. And a lot of this is blood, but there is some other drainage in there. Okay? That's good. Thank you. Again, we're going to see if we can get a little bit of this excess tissue out of here. We're not going to get it all. And some of this inflammation in the skin is going to just have to go down on its own and with the antibiotic, but we don't have any nail left in there. Everything's looking good. So we're going to dry it out really good. And we're going to start the cauterizing with the chemical. We do this part 5 times. Number 1, start now for 20 seconds. Normally the chemical goes just on the root, but I'm actually going to put a little bit on this bleeding granulation tissue to help shrink it a little bit.
Time.
And then we just kind of scrape it, make sure there's no little pieces in there. We're going to do the same thing a second time. "20 seconds, start now.
Time.
Okay. Again, we're also cauterizing a little bit of this skin, which we don't normally do. but because he has so much of that, we want to try to get this to go down. Okay. Number 3. Start now.
Time.
Okay, number 4. Start now. We're almost done. You're doing really well.
I'm amazed at the pain tolerance that these younger children have.
I know.
Time.
Amazed.
You better than a lot of adults do.
Goodness.
And this is certainly worse than about 80% of them. I mean, it's not the worst, but
Yes.
the part I think that's the worst is all this what we call granulation tissue, which you see I got a lot of it out.
Right.
We're not going to get it all, but it's going down quite a bit.
It has.
And sometimes when this persists, post-op, like after the infection's gone and everything, sometimes you still put a little phenol on without even numbing it, just on that tissue. Last one, 20 seconds, number 5. And he had a temporary removal done about a year ago, and as it usually does, it came back the same way. It would have been ideal to get this when it wasn't quite so infected, but with starting the antibiotic should definitely help.
Time.
Okay, now we are going to flush it out with just plain old rubbing alcohol.
Dr. Evie, that looks amazing.
Well, I mean, it's still got a little way to go, but it already looks better than it did.
I know, but that looks amazing.
You got to get a picture of it like in a month
Absolutely.
when it's totally healed,
Yes.
and the skin will be kind of like that.
Really.
You'll still be able to tell. There should always be a little bit of space. It shouldn't look like the other side,
Right.
but it won't be that big of a space as what we have now. And you'll notice the toe looks very white just because we're not letting any blood get into it. But we're going to change that here in just a minute. So I'll take the betadine. Make sure we have Telfa. There we go. Okay. This is Silvadene, which is an antibiotic burn cream. You'll notice the color comes back very quickly. We're going to get a little bleeding, but for that reason we're going to bandage it up pretty big today. I always like to put Telfa on it first, because if you put gauze directly over it, it's going to stick. A nice fluff bandage. And I was going to tell his mom too, if you're going home from here, you may want to put some ice on it when you get home. Because as soon as I took that, and it always does, as soon as I took the tourniquet off, not only did the color come back, but it bled through, which is fine, we expect that, but... Okay, Caitlin, I'm going to have you bandage it the rest of the way. I'm just going to put a little bit more of this on it. We want a little compression on it. So tomorrow morning, we'll go over with you how to take care of it, if neither one of you have. I don't know if anybody's going over it. Okay. We'll have you go over how to take care of it. It's pretty easy. Just keep it dry for today. Put ice on it when you get home. And he should need very little. I mean, maybe Advil, Aleve, Tylenol. Take the antibiotic, be 2 a day, enough for about 10 days. And it should start actually look better just getting all that stuff out of there. But we'll have the report back in about 4 or 5 days. As long as we see that the sulfa drug is going to work on it, Bactrim, then we won't change anything. If it should come back that it's something different, we'll let you know. Otherwise, we'll see you in about 2 weeks, give or take a few days. He did really well. Like I said, a lot of adults don't do as well as he did. So, any questions? Okay. Well, that's it. That's a partial permanent nail removal of one border.